Hi, my name is Rochelle Redford, and I'm co-founder of a company called Livid. This stands for Live, Innovate, Value, Incorporate, and Dominate. This is our motto and success plan in short. The name of our product is FAST. FAST stands for Financial Assistant and Stability Tracker. This application provides financial assistance for both the patient and the organization, as well as provides stability tracking for management of finances. FAST will target helping the consumer or patient, the healthcare organization, and even the insurance company. We call this our triple threat. Our proposition is for 20% stake in Livid. We ask for $2 million. So far, we have done what it takes to invest $900,000 over the past 2.5 years. Now we are to the hard part, the true extension from innovative idea to real solution. We look to have stability for at least 2 to 3 years while the company gains contracts and buy-ins. We would like to entertain the idea of a line of credit that could range to perhaps another $1 million to help with any new research and development programs and help bring in more employees. Our product will take over how we read our medical bills today. We all live fast-paced lives and need complications simplified. Who has time to sit down and make sense or attempt to understand medical bills? The solution? Well, it's simple, but not so easy, and that's where we come in. FAST will provide summaries, data, and visual perspectives. Just as our bank accounts, this will be easy to understand, organize, and therefore manage. FAST can also grow a database to help patients and the organization. Cost predictions can be done based on the insurance benefit a patient has. Such can be entered and verified by the insurance company as well. Patients will have more of an idea of what their costs will be prior to having procedures done. Pie charts are used to show such data as patients' out-of-pocket cost, deductibles, and even out-of-pocket maximums. Patients can also do prediction charts to see where their costs will be after procedures are done so they can plan their health care out for the future. And of course, the layout of the payments will be clearly defined like a bank account. By entering personal information, the application can also help manage costs to stay out of medical debt and keep better track of personal finances. We hope to move research and development into the realm of tracking medical records for patients as well. On the other end, healthcare organizations need assistance in managing the complicated results of patients' financial outcome. A coder will verify ICD-10 and CPT codes to determine what gets billed. FAST can link to online insurance billing options and help facilitate the insurance company to pay the organization. This will help speed up the third-party payment and reimbursement process, cutting down on time retrieving receivables. Analysis and audits can also be done in FAST. If used to 100% capacity, meaning for all patients' accounts, regardless of insurance buy-ins, the application can assist in detailed ratio and capital analysis, charging analysis, charge master enrichment, charge capture assessment, and horizontal and vertical analysis. FAST can also provide functions to hold data on equity, debt, trade credit, cash, budget, future value, and the whole revenue cycle to include gross receivables, net receivables, carrying costs, delinquency costs, and collection period. The organization's charity care can also be tracked and factored into the demands of the Affordable Care Act and the desired target range for the organization, making FAST a true asset for the governing body such as Finance Committee, Auditing Committee, Chief of Medical Staff, and Chief Operating Officer, the Chief Financial Officer as well, of course. There is research and development for planning the horizon and budgeting as well to help the organization with their growth. Currently, while calculations can be available, the numbers will have to be put in manually. Insurance companies can become certified users with minimal cost per year for aiding in expediting services to the clientele and limiting strain on their workforce. We will pitch to insurance companies the idea and, in hopes, look to get them on board with at least verifying the patient's benefits within the application. However, our mark is to sell them on becoming a certified user. Another strong point Because we have made this an application, it will be capable of working on mobile devices. This is where a lot of our beta testing is being done right now. Because we live for mobile devices, it is vital that safe accessibility is a main part of the product's functionality. Currently, we are paying salaries for one software developer as well as myself. We are both the co-founders with an annual income of $90,000, which is lower than the Occupational Outlook Handbook shown as the median pay. We employ 2 computer system analysts that we are paying an annual salary of $75,000. This too is lower than the Occupational Outlook Handbook, and the median pay is at $79,680. In order to take these very experienced IT professionals, we have provided each one with a 5% stake in the company for reciprocation of cutting their annual pay to work for us. We need to grow the IT team, but will not offer the 5% stake to any others taken on. Our cost projections include salaries, advertisement for national publication and web reporting, possibly even television, cost for pitching to organizations, overhead cost, and covering for our inventory, as well as for unforeseen cost. We thought it wise to take into account licensings of our product and are currently creating documentation for any patent and trademark within our application. Insurance of the application is another focus in our review. It is because it's not so cut and dry and is part electronic medical record and part bank in some respects. We were trying to be very wise in this. Respectively, we do predict our annual cost to be around $700,000 right now. We look to charge a moderate-sized organization a one-time upfront cost of $70,000, which covers the integration of the application and training. An annual cost of $7,000 covers maintenance and a limited contract of 5 years. This year's prediction is for 15 organizations to be signed on, which will come to $1,050,000 for the first year, and each preceding year will bring in another $105,000. As new features of the products are introduced, we will charge a new upfront fee depending on the features and will add to the annual amount. We would like to keep this fair pricing as not to scare off our consumers. The insurance value can become considerably the largest part of revenue for the company. Take, for example, United Healthcare, who serves more than 100 million individuals worldwide. Hypothetically, let's say United Healthcare covers 30 million Americans and wants to invest in FAST as an asset to the organization and for their consumer needs. We then would charge a 10% fee based on 30 million consumers. Our total cost would become $3 million for that annual year. We would work off 5-year contracts and would require proof of consumers served for that annual year. If we could show insurance companies how many healthcare organizations are on board, then we could gain a heavy profit from their buy-in. There are thoughts for future research and development to expand into more insurance company opportunities. We really feel that there are some great opportunities in this venture. See, to find who really needs this application and if we're targeting the right stakeholders, we really had to ask ourselves some questions. One was, how much of our annual income goes to insurance? Well, according to the National Conference of State and Legislation 2015, annual premiums edge beyond $16,800 for an average family. Given insurance companies have a need to increase costs for the upcoming year, we are more pressed for time than ever to provide relief to insurance companies in ways to cut their costs and in turn cut costs to the American people. We know FAST can provide such facilitation that insurance companies find help in their standard work processes. And as costs rise, the American people can use this as a tool to not just get the care needed, but manage the costs to stay within their financial means. It is evident that as Americans, we must find ways to manage our finances to prevent debt. If debt is inevitable, our application can help aid patients in getting out of it honorably. And help healthcare organizations regain what could have been considered lost receivables. Who understands current statements? According to Fair Health Consumer, it's easier to review and understand your medical bill if you have an idea of what you should owe before your bill shows up in the mail. In order to understand what you owe, you would need to know what your insurance will cover and the plan type, the contracted rate, if it was covered under an in or out of network, your deductible balance, where the out-of-pocket maximum balance is at, and even what tier coverage it is in for that service. This is a lot to keep track of. This is why our application is vital to manage personal health care expenses. FAST will help keep all of this information in line for you, given the insurance company's buy-in, or you can enter it in manually, and FAST will still help calculate it for you. Another question is, how often are mistakes made in healthcare? According to Kaiser Health News 2010, it's estimated that at least 3% of all healthcare spending, which is roughly $68 billion, is lost to fraud and billing errors annually. With numbers like this, it is evident that we need better programs, better management, and more accountability to prevent ongoing errors that are contributing to the rising costs. With the Affordable Care Act resulting in many healthcare organizations tightening up their spending, it is likely that the amount of errors will rise, resulting in even higher healthcare costs. FAST can help with this. FAST can help take some of the strain off the staff and provide them with much of the tedious work to be done automated. FAST will then be a participant in quality and risk control, aiding in the overall better good for the communities. The last question we really had to take into consideration is, how is this going to support the Affordable Care Act? According to Obamacare facts, the Affordable Care Act will require reform for quality, affordability, improving quality and efficiency, transparency, and revenue provisions. All of such can be impacted by the addition of FAST to help with the billing and revenue cycle. This is one aspect that we will be broadened on quite heavily as part of our pitch to healthcare organizations and insurance companies. We also have plans to continue research and development to prevent stall within the company. We will provide questionnaires and request feedback to better define the application to really help healthcare organizations and the insurance companies and even the patient's population. Ultimately, this is an application for the real world like no one has ever seen before. It is not feasible for families to have time to sit and manage medical bills without something to help. With so many benefits to the healthcare facility and even to the insurance companies, it is hard to imagine not getting positive feedback and buy-in from them both. We also know that this application has so much room for growth, as we can see in a few of our research and development thoughts. Although it is just me here, we all look forward to at least one of you taking part in the development and success of this innovative application. Thank you so very much for your time, and have a great rest of the day.